Many questions still remain about the role of stem cells in MS treatment. Dr. Mark Friedman and nurse Dawn Carl explain stem cells and review current research and their future in the advancement of MS treatment.
Hi, my name is Mark Friedman. I'm a professor of neurology at the University of Ottawa and a senior scientist at the Ottawa Hospital Research Institute in Ottawa, Ontario, Canada.
My name is Dawn Carl, and I'm a registered nurse and the clinical research coordinator in the Department of Neurology, specializing in multiple sclerosis at the Ottawa Hospital.
We're both here to talk about stem cell therapy, specifically in regards to multiple sclerosis.
So when we're looking at stem cells, what exactly are stem cells?
Yeah, this is a real problem because stem cells mean a lot of things, and patients are always asking us, stem cell therapy, is this for me? And I think it's important to know what a stem cell is. There's so many different kinds. Some ethical questions have come up because stem cells originally we would get from embryos, and people started talking about, well, do we sacrifice babies for the sake of stem cells? Actually, stem cells are in all of us. They are remaining since we were an egg. And we can find them and generate them now from just about any tissue. Some of the more accessible tissues are the blood and bone marrow. And believe it or not, you can even get it from fat. So people go to these places and have some liposuction, and you can actually get the stem cells from there as well.
So when we're looking at our MS patients and they're coming into the clinic and speaking to us and asking us about stem cell therapy, what does stem cell therapy mean for the MS patient?
Well, we do something special in Ottawa, and we can come to that in a bit, but I think stem cell therapy as a whole is a huge field.
Absolutely.
So if we're talking about stem cells, we talked about where you can get them from. Stem cells are called stem cells because they have the ability to renew themselves endlessly. And interestingly, they retain the potential to become anything you can imagine. It's quite spectacular. But when we're just a big mass of eggs, how do those, a big mass of cells, how do the cells individually know to become a brain, a heart, a liver?
Right.
Somehow they get a signal and they can differentiate. So that ability to retain self-renewal and become anything, any part of the body, is what defines a stem cell. So you can imagine stem cell therapy is used for a number of things. Like in some congenital disorders, in particular, there's some conditions that lead to bone destruction as a child, like osteogenesis imperfecta. You can actually generate cells that are capable of forming normal bone. If you can get them into those kids, they may develop normal bone function. So the thought is that if we could direct these cells around any particular direction, they could become hearts, they can be used to replenish things, but this is not reality. It's very, very rarely does stem cell therapy actually lead to a new organ. So there are other kinds of stem cell therapy. In some cases, the stem cells help to renew a system like your hematopoietic system. In some cases, they can actually heal. They have healing properties, and we can talk about that in a bit.
Okay, so when the MS patient comes in, what stem cells are we looking at for MS stem cell therapy, and what exactly can the patients expect if they're going through this process?
And this is a problem because we're doing a couple of different trials, right? So we are confusing our patients because we use just this general term of stem cells, but in the case of our bone marrow transplant program,
Right.
we are talking about hematopoietic stem cells that we're giving to rescue patients because we've had to use very, very high doses of chemotherapy to remove their diseased immune system. In the absence of ability to generate a new hematopoietic system, they wouldn't survive. So you need to be able to get the stem cells, and the body actually incorporates these stem cells, they reseed the bone marrow, and then they start kicking out normal cells. So in the context of bone marrow transplantation, it's really a rescue therapy. Now, additionally, we've seen these patients recover function And so it's tantalizing to believe that those cells not only replenish the hematopoietic system and the immune system, but maybe they're capable of repair, which brings us to the other cell type that you can get from the bone marrow, the mesenchymal stem cell,
Right.
which is really a little bit differentiated. It's not quite as pluripotential as the bone marrow stem cell, which can become anything. But the mesenchymal stem cells are also derived from bone marrow, but you have to grow them. So we'll talk later about places that are offering stem cell therapy. Mesenchymal stem cells are just so few in a bone marrow aspirate that you literally have to grow them up in a specific laboratory that is specialized for growth of human cells. And it takes usually about a month to grow enough cells to use. And they might have healing powers, but they are unproven in MS.
Okay. So our patients, where can they get involved in reputable trials for stem cell therapy?
It's a very important question.
Absolutely.
Because so many places that are capable of generating stem cells or isolating them, there's some centers that, for instance, will take the blood and they'll put them through a process and you'll get a little bit of stem cells, not enough to do anything, and then they'll just infuse them in the patient the next day and then they go home. And they're being charged, I think, something like $5,000 for this. That's not going to do anything. We know that's not going to do anything. It's a small dose. There are centers that are involved in our study, and there are other studies that are coming through. They need to be a proper, if you have to pay for it,
Yes,
there's something
absolutely.
wrong with this picture, right?
Right.
So our studies, nobody pays for anything. I think it's the fact that the patient has the inclusion criteria to get in, and then we're trying to test the ability of these cells to actually do something, in some cases repair.
Right. Well, and in a safer environment, a
and-
controlled, safe environment. I
Where-
mean, that's paramount.
And you know that requires us to monitor all adverse events and report them all, and the trials are approved by ethics boards, et cetera.
Right, exactly. So when we're looking at stem cells and all the information that's out there and misinformation in terms of internet and other patients' accounts of what they think is good or not good, are there any misuses or extraordinary claims to stem cell therapy, especially when it's related to multiple sclerosis?
It's actually not just MS. I think if you go to almost every field now, stem cell therapy is being offered. I've heard of centers that are actually putting them into joints. You can get stem cells, and rather than have your knee replacements, have some stem cells shot in there, and somehow that's magically going to fix your arthritic joint. But they really caught on because the technology is out there, and there are many laboratories that can operate and offer stem cell therapy in a safe way, but patients are not guaranteed anything except that it's going to cost them some dear money
Right.
to have the therapy. And then who knows whether these testimonials and claims are validated or verified. I think that a proper stem cell program like ours has to go through a number of checks and balances. And if patients are out there looking for this therapy, the questions they should be asking are, is this an approved trial? Has it got ethics approval locally? Why is it costing me money? It shouldn't cost me money if I'm part of a trial.
Exactly.
Are these cells grown? Because if they're just derived from a tissue and then re-injected, it's unlikely that they're going to do anything. If it's growing in a facility, is the facility a proper accredited facility for the growth of human cells? This is the case in North America, in our country, in the US. You have to have what's called a GMP approval to grow the stem cells. If you go outside, if you go to Central America or Mexico or China, I don't know that those facilities are carrying the same kind of accreditation. It's dangerous.
Absolutely. Yeah, for sure. So I guess the bottom line in the message we need to give to the patients is find a reputable center that's regulated where the patients are going to derive safe and effective treatment, and it's regulated by health authorities.
Yeah, and the two commonest treatments for MS right now are the bone marrow transplant and rescue stem cell therapy and the potential for mesenchymal stem cell therapy. Those are the two commonest ones that are out there. The bone marrow transplant one, I think, is proven.
Yeah.
But it depends on the regimen you're using. The mesenchymal is unproven and is in active study. If you want to get involved in these studies, it's important to localize where they are being done, seek out the various universities, because they're usually academic centers that are performing these, and then you can inquire of the principal investigator if the status of the trial is still enrolling. There are also several websites that provide information about ongoing studies.
So one of the most reputable websites in clinical research is clinicaltrials.gov. Any research that's validated, regulated through your health authorities in Canada, the United States, and actually worldwide. It's an excellent source of information. You can go in there and put in multiple sclerosis and see the trials that are happening throughout the world, where they're being recruited for, or if the recruitment is closed. But there's also direct links that you can click on there to get the information about the trials. It's important that the information that the patients are looking at is good information and valid information. We all know that in the world of Google, there's a lot of misinformation out there. So if we direct your attention to anything, go to clinicaltrials.gov, and then you can see the most up-to-date and most recent information for clinical trials that are in an area near you.
And I think both our country's MS agencies carry some information about stem cell therapy.
Yeah.
I know the MS Society of Canada has some information on their website, and so does the National MS Society in the United States.
Both very good resources.